Hey, welcome. Today, we're going to pull back the curtain on modern medicine. We're going way beyond just the pill bottle to really understand the huge hidden world that brings these life-saving treatments from just an idea all the way to your pharmacy. All right, let's get into it.
Have you ever really thought about it? What does it actually take for one single pill to even exist? It's a question we don't ask very often, but the answer reveals one of the most incredible collaborations in human history.
So we have this idea in our heads, right, of some lone genius in a lab having this sudden eureka moment. But the reality is so much more complex and, frankly, way more interesting. It's not one person. It's a whole ecosystem of thousands and thousands of people all working together in this constant cycle of discovery, safety, and education. So let's break down the pillars of that ecosystem.
First up, we've got the engine room. This is the relentless global effort to understand and fight the diseases that we are all facing right now.
The turn of the millennium was just an absolutely electric time for medical science. Researchers weren't just taking baby steps, they were launching these super-focused attacks on dozens of different fronts all at once.
Just look at the sheer density of what was happening here. In just a handful of years, you've got foundational work on drug safety, brand new treatments for painful migraines, and huge advances against chronic conditions like osteoporosis and diabetes. And every single line on this slide represents a whole team of dedicated people. All that work leads to real-world results, like the approval of lacosamide in 2008. But this incredible pace of discovery, it also created a brand new challenge. How do you make sure every new thing is not just effective, but also safe? This engine was running hot, and it needed a safety net to match.
Which brings us to our second pillar, because all that discovery would be useless, or, even dangerous, without the global safety net that protects patients every single step of the way.
So you have to wonder, right? With thousands of new studies and new drugs popping up, how do we make sure they're actually helping, not harming? Well, the answer is a system of constant, and I mean constant, vigilance.
And it's not a one-and-done approval. This slide shows the process perfectly. It's a continuous cycle. Research doesn't just stop once a drug hits the market. It keeps going, looking for long-term effects. When a risk is spotted, like that FDA review of osteoporosis drugs back in 2011, agencies like the FDA and Health Canada spring into action with warnings. And then, and this part is so crucial, organizations like the Joint Commission update their official guidelines to stop errors from happening in the future. It's like a living, breathing safety system.
And this simple phrase from 2004, it perfectly captures the whole philosophy. Use caution, avoid confusion. Every warning, every updated rule, it's all driven by that one core principle. Protect the patient by making things crystal clear and preventing mistakes. It's just a great reminder that in medicine, safety is never a destination, it's a continuous journey.
Okay, so let's move to our third pillar. We've got discovery and we've got safety. But how does all this vital information actually get into the hands of the people who treat us day to day? Think about it. We just saw this explosion of research and a constant fire hose of safety updates. It would be literally impossible for any one person to keep track of it all. And that's where the knowledge builders come in.
These are the unsung heroes of this whole ecosystem. People like Kathy Moscow and Karen Snipe, who write the essential textbooks for pharmacy technicians. Or teams like Calant, Grant, and Mitchell, whose work becomes the cornerstone for an entire country's medical education. What they do is they take these mountains of raw data and they translate it into practical, usable knowledge for the nurses, doctors, and pharmacists on the front lines. They're the critical link that connects the lab to the clinic.
So we've seen the research, the safety net, and the education pipeline. But why? Why does this whole massive ecosystem even exist? Well, let's zoom out and see the human scale of the challenges it was built to solve.
34 million. Just let that number sink in for a second. That's not just a statistic. That was the number of people living with HIV across the globe in 2010. And every single one of them was a why, a reason for this ecosystem to push harder for new research, to demand better drug safety, and to educate professionals on how to give the best care.
And these challenges are everywhere. Take this 2009 report on asthma in Canada. It doesn't just show that millions are affected, it reveals these specific patterns, right? Like higher diagnosis rates in females at 9.4%, compared to males at 6.7%. This is exactly the kind of data that drives targeted research, that informs safety warnings, and shapes what respiratory therapists and nurses learn in school.
So what it all comes down to is this.
The ecosystem isn't some abstract scientific thing. It's a direct, living response to the real-world needs of millions and millions of people. Every single part of it is fueled by the desire to ease human suffering.
So, let's bring it all together. When you look at all these interconnected parts, the research, the safety, the education, all of it driven by real global health needs, you start to see that it isn't just a process, it really is an ecosystem.
And that is the key takeaway. It's a living system where every part influences all the others. A new discovery triggers new safety reviews, which leads to new chapters in textbooks, which then inspires completely new areas of research. A drug's journey doesn't just end when it hits the shelf. In a lot of ways, it's really just getting started.
So the next time you look in that medicine cabinet, just remember what you're seeing. It's not just a pill. It's a testament to a vast, sustained, and deeply human effort. It's the product of an entire ecosystem dedicated to our health and to discovery.
And that leaves us with one final thought. This ecosystem is always evolving, always adapting to meet new challenges. So what do you think is next? What's the next great mountain that this incredible collective human effort is going to have to climb in our lifetime? Something to think about. Thanks so much for joining me.